Hey y'all, I just wanted to share that I just failed my ASRT CT Basics Module 7 tests. We have this HLC thing that we have to do to continue our knowledge bases for work, and so they make us do this ASRT thing. I'm gonna go over my questions and see why. So I got 17 correct out of 30. Horrible. Question number 1. Coronal and sagittal reconstructions of the lumbar spine require a slice thickness of blank milliliters. And I actually answered that correctly. It's 1 to 2. So they're just asking, what's the slice thickness? You want it smaller, just in case there's any fractures. So that's just intervals and stuff like that. So C-spine is normally 1 for us, and then T-spine is 2 millimeters, and lumbar spine is 2 millimeters. So the answer is 1 to 2. Question number 2. When performing a routine CT scan of the neck, which pitch would result in the highest patient dose? So I answered 1.7, and the correct answer is 0.7. In my mind, I was thinking the longer the pitch, because the pitch is how long the patient is going through the table, they would receive more radiation. And for some reason, 0.7 pitch would result in the highest patient dose. So I don't get it, but that was my thinking of why it's 1.7. The longer you're in the table, the more radiation. But I was wrong. Okay. So the standard window width of blank is used to demonstrate brain tissue. Now, I'm really bad at window width and window level. Like, I haven't sat down to really study the window and leveling. I just know what window looks like what. So I put 60 to 80, but the answer is 80 to 100. So I know it's not a high number, because a high number is a bone window, like 1,000, 2,000, it's more bone window. Anyways, the answer is 80 to 100. So hopefully I remember that for next time. Window width is 80 to 100 to demonstrate brain tissue. Number 4, the optimum enhancement of blood vessels and organs on a routine abdomen pelvis CT scan. The average adult patient should receive blank milliliters of IV contrast. It says 100 to 150, because this one bottle is about 100 milliliters. And that's what I answered. Normally I would give less, because I don't want to give too many patients a lot of contrast because of the kidney. You don't want to mess up someone's kidney because it's very dense and concentrated, and you want them to filter it, especially if they have underlying diseases. But the answer is 100 to 150 for an average patient to see blood vessels and routine organs. Another window width and window level question. The recommended bone algorithm window width and window level for routine thoracic and lumbar spine CT is, I got this right, window width of 2,000 and window level of 200. So window width is 2,000, window level is 200. Remember I said bone window is a lot higher because you want to see the bone more clearly. It's more dense. Okay, number 6, I got wrong. For a spiral helical CT scan using a multi-detector configuration, the recommended pitch is, I put 1 to 1.2. CT head, okay, so the answer is 0.7 to 1. I was close. 0.7 to 1. Next question. I should have known this. I contemplated. So don't always go with your instinct. So which of the following terms refer to the center of the scan field? Center. I've mentioned before, isocenter, the middle. You want in your gantry, you want your subject to be right in the middle. And I was contemplating, I don't know why I did it. I thought there was like an actual term for it. I always said isocenter. That's the answer, isocentered, but I put z-axis, and it's not, because you have your y, x, z, LMNOP. Just the answer is isocenter, the middle of it. Okay, for a CT scan of the neck, the recommended display field of view, which is DFOV, is blank centimeters, and the scan field of view is blank centimeters. Okay. So, scan of the neck is recommended display field of view. So the answer is 22 to 25 display field of view and 50 scan field of view. So the difference between display and scan. Display is what's going to show up, what you coned in. When you cone it in, then that's what's going to display on your screen. But even if you cone in, all the outside area is also being scanned. So just because it's showing this much that you're scanning in the thing in your computer, it's not just going to be this portion that's scanned, because because let's say you're scanning the neck or your T-spine, your shoulders and stuff or your body's still going to be scanned even though you're coning in, because it needs to get through these anatomy. So that's the difference between display and scan. So the smaller number and bigger number. That's why I got it wrong. Okay, for routine abdomen pelvis CT scan, the recommended scan field of view is 50. I put 65. The answer is 50 centimeters. Recommended scan field of view. But it depends on a person's anatomy, right? But that's a recommended. Okay. Next question. When scanning a head with IV contrast, a scan delay of blank is recommended. Okay, I contemplated on this one too, but I think the longer the better, because when you're scanning a head, you want the contrast to go through your blood-brain barrier, and that takes a really long time. My facility, we actually scan at like 2 minutes, and I feel like that's too short, which it is, because you normally give a CT head scan with contrast for like IV patients, any infections, any malignancy and stuff like that. So a longer delay is better for your brain. And the answer for this is actually 3 to 4 minutes. That's the recommended IV contrast for the head. But I feel like the longer the better is still also. But some facilities, they just want to get your patients in and out. Just speaking honestly. Next question. For routine abdomen pelvis CT scan, the slice thickness should be 5 millimeters and the slice interval should be 5 millimeters. I answered that correctly. The recommended slice thickness for a routine CT scan of the neck is blank millimeters. So it's very important to look at millimeters and centimeters. They keep changing this, and I just kept going through. So that's why I got it wrong, I think. The answer is 2.5 millimeters to 3 millimeters. That's what you want for the neck. I put 1.5 to 2.5. Okay, next question. When performing a routine scan of the neck, which pitch would result in the highest resolution? See, I don't get this. So they're saying highest resolution, that means you want a clear image. So I put longer pitch, because the longer the pitch, the better the image would be. But the answer is, again, 0.7. I need to read into this. Keep getting it wrong. It doesn't explain why. Next question. For a routine thoracic lumbar CT of the adult patient, the recommended scan field of view is, the answer is 50 centimeters. And the recommended display field of view is 12 to 20. I got that wrong. When performing a routine CT chest, the scanner should be zeroed with the laser light at the top of the shoulders. So start up here, zero it out at the top of the shoulders. Next question. To assure quality image of post-processing reformats of the ankle joint, a blank millimeter scan thickness and a blank millimeter scan interval is appropriate. So I went with the smallest one. No, the second smallest ones. It's 0.75 to 0.4. Got that right. And they try to trick me with 0.75 and 0.04, but that's too small. That's like a volume scan, really small volume scan, because you really want to see the ankle joint. You want it small to see if any fractures there. Next question, for a routine chest CT, the recommended pitch is, I got this wrong, it's 0.8 to 1.35. I put 0.8 to 1. See, when I go lower, they want to go higher. Okay, for a routine CT of the neck, the gantry should not be angled. So it doesn't matter where your EAM is, your orbital line, anything like that, doesn't matter. Because it's just your esophagus and, you know, your sinus and all that stuff. So no angle for CT neck. For post-processing 3D image of the CTA, which pitch would provide images with the highest quality? Answer, I got this right, 1. Next question, the topogram image for routine abdomen should include your axilla. So when you start, you zero it out. You call it the nipple line, or you can also reference your axilla, so your armpits or your nipple line. So start there and you end at the iliac crest. You're the bottom of the pelvis. That should include your abdomen, because you want where your diaphragms are, and that's about your axilla area. Axilla, nipple line, whatever. The trigger threshold for pulmonary embolism CT exam is blank Hounsfield units. So they're just saying when you trigger for a PE study and you put your ROI there, your region of interest, so that it could do your scan time. Can calculate the Hounsfield as a contrast. It's supposed to be at 90 to 100 Hounsfield units. Next question. The topogram of a CT scan of the neck must include vertex of the skull, so bottom of the skull to mid-chest. I got this wrong. I put axilla and OML. So bottom of the skull to mid-chest. But mid-chest is kind of like subjective, I feel like. Anyways. Next question. For routine abdomen pelvis CT, the recommended window width and window level is, yes, I got this right. Window width is, you want a soft tissue, so it's not high, it's lower. It's 350 to 400. And window level is 40 to 60. Next question, I got it wrong, is window width and window level for CT chest, so that it displays the lung and the air-filled space of the chest. It's a lot higher. Window width is 1500, window level is -600. So there's a lot of air, so I thought negative number, so that's what I did. I wrote window width of 40 and window level of -600, but it's a higher window width. Interesting. Okay, next question. The scout or topograph image for a CT head must include through the vertex of the skull, C1. So you want your first cervical spine to be included in your head scan, because if someone I don't know, I think just because it's right where the skull is and your medulla oblongata and all that stuff, the brainstem comes down and it connects to C1, it should be included. Not a radiologist, I don't get paid that money, but hey, C1 included in your head. When scanning a head or brain, which radiographic baseline should be oriented parallel to the axial scan plane? Your orbital meatal line, OML. That should be perpendicular to the table. So you want your OML. This needs to be perpendicular. So if the head's like this, the table's right here, you just bring it down so it's perpendicular and straight. Okay, the trigger threshold for an abdomen pelvis CTA is what Hounsfield? It's 125 to 150. So that's like CT angiogram. You want a brighter, later scan. PE is 90 to 100, CTA is 125 to 150. I guess that also depends on the scanner that you have too. Okay, next question. Which of the following conditions of the indication of CT scan of the head without intravenous scan? So what's one reason for a non-contrast CT head? That's the question. Stroke. You want to see if they have a bleed. Once you introduce contrast, the contrast can be mistaken for blood, and you don't want that. You want to see a non-contrast head for stroke to see if there's an ischemic, hemorrhagic, any type of bleeding in the head. Okay, 2 more questions. CT head exam, scan field of view, and display field of view. Recommended is 25 millimeters and 25 millimeters. Got that right? For a routine chest scan, recommended scan field of view is 50 centimeters. And that's it. So get that going, and I hope you got some information from that, because I learned from my mistakes, and hopefully I can score better. And yeah, so thought I'd share my failure so we can both get something out of this. Okay, toodles noodles, and don't forget to check out my other YouTube channel, Kamani on Earth, or check out my Instagram, kamani.d12. You can ask questions there if you want. Maybe not. All right, toodles noodles.